Hello class, this is part 2 of our presentation on the cardiovascular system coding. So I'm going to start in the middle. If you would, please open up your coding manual and turn to in the front section of your coding manual. If we can start with code 35301, and this is under the section entitled thromboendarterectomy. That's a procedure in which they make an incision into that artery to remove a thrombus or plaque that's within that artery. These codes are differentiated according to the artery on which the procedure was completed, and the code range is 35301 through 35390. In your textbook, it shows you a picture of a thromboendarterectomy procedure. If you're looking there in your coding manual, you get some idea of that. After that subsection, you have a section on angioscopy. Code is only one code there, and that's an add-on code. It's a 35400. And when you have a scope, then that's when you have a scopy type procedure. And so this is where that scope is going to be looking at a non-coronary vessel when you're using this code 35400. I need to advance the slides as well. Alright, and because it's an add-on code, you know you have to use it with alongside another code. It can't be used alone, and in this case, it's used in conjunction with a code for a therapeutic intervention. Now from there we have a section on transluminal angioplasty, and when we're dealing with anything with a plastic suffix, we know we're dealing with a repair. And so in this case we are repairing a vessel, and when we're coding in this section, we have to know where the angioplasty was performed and if they use a open or percutaneous approach in order to assign codes in this section. So with a transluminal angioplasty, they use a needle in which they put in that artery and then advance a balloon using a catheter, and then they inflate that balloon. So again, they are trying to clear the way so that they can resume a normal blood flow through that vessel. Okay, and you can see very clearly in your coding manual where you have a section for open transluminal angioplasty and a percutaneous transluminal angioplasty. Now, I do have a video to share with you to illustrate this procedure. So if you don't mind giving me just a second to get the video up.
Xerox is the company that's all about supporting hospitals using electronic health records.
Non-cardiac percutaneous transluminal angioplasty. A surgeon will perform a non-cardiac percutaneous transluminal angioplasty, or NCPTA, to restore blood flow in an artery blocked by atherosclerotic plaque. Fatty deposits called atherosclerotic plaques can build up inside your arteries, narrowing the passageway and interfering with blood flow. This arterial blockage is called stenosis. Insufficient blood flow to a tissue generally causes pain. A non-cardiac percutaneous transluminal angioplasty is only done when your condition has not responded to less invasive treatment options, such as lifestyle changes and medications. To begin the procedure, you'll be placed on a table equipped with a fluoroscope. A fluoroscope is capable of taking X-ray images of many parts of the body from multiple angles. Your doctor will numb your skin around where the catheter is to be inserted. Since the arteries of the leg are most easily accessed, the femoral artery in the groin serves as the insertion site in most cases. Your doctor will initially gain access to the artery by inserting a hollow needle through which the balloon-tipped catheter is passed. Watching on the fluoroscopy screen, your doctor will gently advance the catheter until it is positioned in the artery being treated and inject a special dye. This dye allows the fluoroscope to take X-ray images called angiograms, which lets your doctor identify the exact location of the blockages. Next, your doctor will move the catheter until the deflated balloon at its tip is positioned at the site of the stenosis. Then, by rapidly inflating and deflating the balloon, your doctor will gently push the plaque and vessel wall out, partially reestablishing blood flow. This procedure may be repeated for any additional blockages. In some cases, your doctor may place a stent, which is a wire mesh that remains in the artery to hold it open. To perform this procedure, your doctor will place a collapsed stent over the deflated balloon on the tip of the catheter. When the balloon is inflated, the stent expands and locks into place. At the end of the procedure, your doctor will remove the catheter through the original insertion site. After your procedure, a pressure bandage will be applied to the catheter insertion site, and you will be asked to lie still to prevent bleeding. You will be carefully monitored in the recovery area to be sure blood flow through the affected artery is maintained. Most patients are discharged the same day as their procedure, but some remain in the hospital 1 to 2 days for observation.
Okay. All right, so that gave you a pretty good picture of the transluminal angioplasty procedure. From there, the next section of codes deals with bypass grafts for the vein. With this code, they start with the 35500. And when you're coding in this section, you have to know the location of the vein graft anastomosis. In this section, as well as with other bypass sections, when they are using the saphenous vein, that's going to be included in the code. If they're using a different vein, then you're going to report that as a separate service. Also, you have, if you flip, you got bypass grafts other than the vein, and some type of artery or other material might be used, and then you will have to use the bypass graft other than vein subsection to code for materials other than a vein. Right beneath that, you have a section there for composite grafts, and basically that means you're using some type of synthetic material of some sort. And so if that's the case, then you're going to use codes in that section. And if you notice, those are add-on codes. Therefore, you're going to have to use those codes in conjunction with some other codes. If you pay attention there, you see notation telling you exactly where, with which other codes you need to use them. So for example, under your add-on code 35682, it says use this code in conjunction with 35556, 3566, 35570, and so forth. So if you pay attention to your notes, you will get some type of direction on where you need to go or what code you need to append that code to. Beneath that, you have some coding here for adjuvant techniques, and basically these codes here are also add-on codes, and you notice they talk about it involving using a patch or cuff in the procedure. Then you have the other add-on code talking about the creation of a arteriovenous fistula for bypass surgery. So that's your two add-on codes, and they also have notations as to which code you need to use those with. You have another little small section here for arterial transposition, and that's your code range 35691 through 35697. Again, these codes here are for blood flow improvement, those type procedures, and you do have an add-on code in there for re-implementation. Following that little section, you have another section that covers excisions, explorations, repair, and revisions. All right, pretty self-explanatory there. So let's keep going, and then you have a section on vascular injection procedures. You have a nice picture there in 36002 illustrating one type procedure. Basically, in this section, your textbook tells you that this can be kind of difficult for new coders because you're going to have some knowledge of vascular families. Because a lot of your coding is, in order to assign the code, you have to know where it ends up and what vessel it ends up in. Now, I can tell you that in your coding manual, you have an appendix that could also assist you with this. I know that back in A&P, you know, the vessels, the different vessels in the body was quite numerous, and it could be very complex type study. But in your appendix L, in your coding manual, if you flip back there, it breaks down the different vascular families. First order, second order branch, third order branch, beyond third order branches, and so forth. So you can put this to use. That's Appendix L if you find yourself coding for vascular injection procedures. This is in your code range 36000 through 36598. Now, two terms you need to be familiar with in this section is that of non-selective placement and selective placement. If there is non-selective placement, that means when they insert that catheter, the vessel that they puncture to begin that insertion, if it does not go, that catheter doesn't go any further than the vessel in which they punctured, that would be non-selective placement. Selective placement is when they puncture a vessel and moving that catheter through, but it ends up in a vessel or a vascular family other than the one that they punctured, then that would be known as selective placement. And so when they move that catheter from one vascular family to another, then you're going to have to report that code separately. If they use radiological services, this has to be reported separately as well. In your CPT manual, there are a lot of notes here, and it's going to indicate to you what should be included and what should not be included. So you have to pay quite a bit of attention to that. Now, in this section as well, you will see in the codes themselves, you have some procedures using particular devices. You have what we call a venous access device, our catheter, which helps allow access to the venous system to send in different types of medications or fluids in the body. And then you also have a central venous access device. And with that central venous access device, it can be either centrally inserted or peripherally inserted. If it's centrally inserted, that means it's inserted into the jugular, your subclavian, your femoral vein, or your inferior vena cava. If it's peripherally inserted, it's in your basilica or your cephalic vein. Okay? So they can use it for IVs and stuff and things like that. If you notice in those codes, and let's see, if you look in those codes there, in the 3600 and a little further along, you'll see codes for those devices in terms of inserting them, repair of the devices, partial replacements, complete replacements, and removals. Your book tells you that if you are coding for a removal, you're going to basically have two codes. One for the removal, well, when coding for replacement, you're going to have two codes. You're going to have one for the removal of the old device, and then a code for the new device that's replacing the old device. Now, I do have a video I would like to show you for a peripheral inserted device, peripherally inserted central venous access device. All right, so give me just a second to share my screen with you. Okay.
There are a number of procedures you may request over the course of your treatment. One of them is a peripherally inserted central catheter, or PICC for short. It's a long, flexible tube used to deliver fluids and/or medication into your body through a vein in your arm. Using a needle and local anesthetic, a radiologist or certified nurse will insert a thin wire to guide the catheter into a large vein leading to your heart. Once inserted, the PICC catheter will allow direct delivery of medication or fluid for several weeks without having to use a needle or IV each time. Regular care must be taken to ensure the catheter is working correctly and the dressings remain dry and clean. For example, PICC catheters require a special saline or other fluid at least once a week to ensure proper flow. Your nursing team will show you how this simple procedure is done. When no longer required, the PICC can be easily removed, usually by your nurse, after the last of your medication has been delivered. To learn more about the day-to-day care of your PICC catheter, consult your nurse or a member of our care team.
Okay. Stop sharing. Okay, and that's, I meant to tell you, PICC, is the acronym for the peripheral central venous access device. And if you ever been in a hospital or a family member has been in a hospital, I'm pretty sure you've seen them using the IV to administer medications and fluids. And so this is the code range you're going to use to represent that service. Okay? Now you have another section. If we flip on over in your coding manual, it starts in your code range 36600. Let it flip over. So that the central venous access device is a large section. And if you get to 36600, HIM2253C, you'll see in blue there arterial, and then you'll flip over and you'll get to the arterial venous. And you got a couple of different procedures that are falling under this subcategory. And so all these procedures under here are going to involve arteries and veins. And start there with your arterial and intraosseous codes. So you got arterial punctures and catheterizations in here. Needle placements are also in that section. You also have under here codes for hemodialysis access, shunt insertions are in this section as well. You have portal decompression procedures, and under those fall your venous anastomosis, revision of shunt, and those type of procedures fall under that code range. And it starts with 37140. You probably have to flip a couple of times. You'll see it there. Portal decompression procedures, beginning with code 37140 for venous anastomosis. And then there's transcatheter procedures under this section. And you have several procedures falling under that. Thrombectomies, venous or arterial ones, injections for drugs, biopsy sampling, stent placement. You just need to make sure you take a look at a lot of your notations there. And you have some nice pictorial examples in that section as well. After that, you got codes for endovascular revascularization, starting with code 37220. They use that this procedure for occlusive diseases, maybe in your limbs. You have a code for each extremity vessel that they treat. And then there's some services that are included in that code. You just make sure you read your notation. Under this here coding section, you got several different notes there. If you look, if you look at code 37220, you flip there, and it's, a very large section there, telling you about different things about lesions, closure of the arteriotomies, imaging completed, balloon angioplasty, stenting. There's a whole bunch of notes. So it will do you well, serve you well to read all over those when you find yourself coding in that section. And if you also notice, it's kind of divided in several territories there. You got iliac, femoral popliteal, tibial perineal, iliac vascular, and femoral popliteal. There are 3 vascular territories, and just make sure you read those notations as to how to code in those different sections. From there you have coding for vascular embolization and occlusion, as well as ultrasound services. And then you also have 2 endoscopy codes. They're at 37500. You flip there. One for vascular endoscopy, and then the other one is just an unlisted code. So that 37500, they call that SEP, right? Vascular endoscopy, surgical with ligation of perforator veins, subfascial. Okay? So that's just 2 codes there. And then finally, you have your ligation codes. You see ligation for jugular vein, carotid artery, a fistula, and so forth. And basically, ligation, all that is when they're tying off blood vessels and dividing and stripping vessels. That's what they mean by that. And so if you're coding that section, you got to know the type of procedure and where the procedure is located. Okay? Now, and then under your other procedures section, you only have 3 codes there. You have penile revascularization and penile venous occlusive procedure, and then you have an unlisted procedure code. All right, this is going to conclude all our procedures and coding sections under the cardiovascular system.